Healthcare. No matter how much you may dread it or even try to avoid it, everyone needs it at some point in their lives. Now, living in the United States, we have access to some of the finest amenities in the world, and usually we think of healthcare to be one of them. But upon closer inspection, should we really? Well, the answer is a little complicated. Now, it's no secret that the United States healthcare system is infamous globally for having exploited millions of people due to its high costs. Today, one of the leading causes in bankruptcy in the United States is the inability to pay medical bills. Now imagine this. You're coming home from work and you take a step off the subway train, and every day occurs. But today is different. Today, you fall into the gap between the platform and the train and you find yourself stuck. You look down and you can see the white of your bone, and despite the pain shooting up your thigh and the tears flowing in your eyes, you only have one thing on your mind: how much this is going to cost. Knowing that having to pay for this treatment will leave you penniless, you yell out to bystanders, "Don't call an ambulance!" And despite this sounding like it's straight out of a dystopian reality, this is exactly what happened to one 45-year-old woman in 2018. This was 5 years ago, and our healthcare system still hasn't changed, and that's the problem here today. United States healthcare is just way too expensive. Now, some of you in the audience may be thinking, well, that's what insurance is for, right? Just get better insurance. It's not exactly how it works. 43% of working Americans were inadequately insured in 2022. Now, with some of these people struggling to pay the bills or put food on the table, the last thing on their mind is having to pay for insurance or healthcare. Fortunately, in cases where the patient can't pay the full bill, hospitals can't just turn them away. Unfortunately, however, it is now on the patient to cover the entire expense straight out of their own pocket. Now, we all know that getting sick or getting hurt is completely unpredictable. And this means that one bad fall or falling victim to an illness can effectively bankrupt citizens around the United States. The United States healthcare system is also consistently criticized due to its lack of transparency. Patients are often taken aback when they see an exorbitant bill with a plethora of seemingly technical charges that can, in reality, be things as simple as putting on Band-Aids. I guarantee that if you were to go on the internet right now, that within 5 minutes you'd be able to find a story of somebody complaining about outrageous medical bills, charging for things as little as crying in the room and charging as emotional support, or even charging mothers for holding their own children after giving birth. Rooms in the emergency department can cost thousands of dollars, and without the proper insurance, this can cause irreparable damage to a person's bank account. On top of this, patients often may be subjected to unnecessary procedures which can just wrap up the bill. Now, Americans may feel hopeless entering this ongoing battle that is the American healthcare system. It creates an air of uncertainty in the lives of those who literally cannot afford to get sick or get hurt. Looking overseas, we see a system of universal healthcare across the world. But that means that there's free healthcare. And while that sounds like it'd be a blessing to many Americans, it just really wouldn't work here in America. For example, let's take a look at Denmark. Denmark is a country with one of the lowest mortality rates and one of the best healthcare systems around the world. Denmark's taxes make up 50% of its GDP as opposed to a 25% here in the United States. This is a huge difference, and those higher taxes are partially why that they can have that free healthcare. On top of this, the population of the United States is just way too big to have a universal healthcare system. For comparison, Denmark's population is similar to that of Colorado. Even the UK, another country with universal healthcare, has a population 10 times smaller than that of the United States. Unfortunately, as much as I hate to admit it, the United States just cannot support a universal healthcare system. So what can we do? In a system where it feels like the patient always loses in one way or another, there are some things that we can do in order to take back control of our healthcare. First of all, hospital bills may sometimes simply be inaccurate. Hospitals may charge you for the wrong amount of time stayed, or even they may charge you for a different kind of room than the one that you were actually in. This can make a huge difference, seeing as care in the ICU can cost 4 times more than general hospital care. Some of you may have heard of phantom charges. These are charges that the hospital automatically puts in place due to how often they're needed, but sometimes they're not needed, but the hospital will neglect to take these charges off bill unless the patient actually files a complaint. It's important that patients and their families stay hyper-aware of exactly what kind of procedures are being done on the patient, what kind of tests are being run, what kind of amenities are being provided, as sometimes the hospital may reschedule a procedure, or they may provide you with multiple bills, and you may get charged for the same thing multiple times. Now, one of the most devious tactics that hospitals may use are called upcoding and unbundling. Unbundling is the process by which a hospital essentially unpacks the cost of a procedure into multiple steps. And it's going to get really hard for a patient and their insurance provider to accurately determine the cost of the procedure. And this can make it way harder for a person to get the kind of coverage that they need for a procedure. Upcoding is when a hospital simply just charges more for a procedure. This combined with unbundling can drastically increase the cost of a person's healthcare, and it can lead to uneducated and unaware patients being taken advantage of and overpaying for their care. It is important that patients around the United States realize that they do have some kind of power in this seemingly unfair system. You have the power to fight unfair medical bills by staying aware of some of these underhanded billing practices that the hospital may use. You should always contest inaccurate bills, and you should always stay aware of your rights. As patients, we need to be our own advocates. Now, equipped with some of the knowledge that you can use to protect yourself, I hope you feel more confident standing up for yourself against the healthcare system. Let's move forward and create a world where one day people can feel truly comfortable calling for help when they need it without having to worry about the help. Thank you.